Good morning, family. We're going to talk about hypertension and using food as medicine and herbal remedy to support. By support, I mean stabilize and reverse hypertension. The very first thing you need to understand is what is hypertension. Hypertension is the increased pressure in the heart and the supporting arteries, veins, vessels, capillaries due to increased stress or pressure on the cardiovascular system. That stress and pressure is coming from the brain and it is coming from the environment. And in minor cases, it is coming from an obstruction or an oddity, something funky going on with the pipes, right? So what you need to know is that there are 4 kinds of medicines, A, B, C, and D. That's ACE inhibitors or ARBs, beta blockers, calcium channel blockers, and diuretics. 4 categories. There are a few others, but they're all sort of outliers. Under very specific circumstances would a person have those outliers. So what you need to know is that ACE inhibitors, they relax the veins. Here are some plant-based alternatives for ACE inhibitors: flaxseed, blueberries, hawthorn berries, hibiscus. And the list goes on. Beta blockers. Beta blockers help to, block the adrenaline running in the bloodstream. So some plant-based alternatives for beta blockers are blueberries, blackberries, any level of fruits, especially water-based fruits like cucumbers and tomatoes. And then there are herbal alternatives for this. I would suggest snake root, hawthornberry, and barberry. So next is calcium channel blockers. Calcium channel blocker is doing exactly what it says. It is decreasing the amount of calcium that's running through the heart. And that's important because everybody knows that calcium makes things more rigid or more firm. And when you have hypertension or intensity, too much stress in the heart, you do not want it to be stronger. You don't want it to be getting more rigid. You want it to be more relaxed. So that's what a calcium channel blocker does. So foods that operate in the same way as a calcium channel blocker, I got a list for you. It's ginger, brown rice, black rice, oats, and all things that are like super grains to support removing and relaxing the calcium in the blood and toning in a more gentle yogi kind of way the arteries. Then there are herbs that can do this as well. They are going to be black seed is going to do that, horsetail, dandelion, and hibiscus. And the list is long for this, but those are some options for calcium channel blocker. Then finally, there's diuretics. Diuretics are basically water pills is what people call them. But a diuretic is casting the salts and the water out of the bloodstream. Obvious problem with that, but we're going to talk about that later. But the diuretics, the benefits for diuretics are going to also be dandelion and hawthorn and horsetail and black seed. They work as well. Same thing. You can use those for the same purpose. So more information about this. Next, we're going to be talking about some of the categorizing the pills. So you know whether you have a calcium channel blocker or a diuretic. That's really important that you know what you have so that you can know what food to use as medicine. So now let's talk about the categories of the medicines for hypertension and let's see which medicine you have. So if your medicine ends with the term pril, then it's probably an ACE inhibitor, which means it's designed to relax the arteries. The same thing for the ARBs. So if your medicine ends in artan, like losartan, then it's an ARB to relax the arteries. So here's some of the challenges with the ACE inhibitors and the ARBs. With an ARB, you may get an issue of a chronic cough and sort of like cough that doesn't go away. Also this feeling of needing to clear your throat or feeling mucus forming in the throat. Also with the ACE inhibitors, they can very often decrease your hydration, making an issue for needing to keep the body hydrated. So pay close attention to that. For the beta blockers, very often you can feel swelling or edema around the ankles and sometimes occasionally around the knee. But that ankle swelling is a big deal, feeling all of that moisture pooling around the ankles because, as I said, the medicine is it's working to extract some of the components out of the bloodstream, and the water is one of them, just like the diuretics will, and we'll talk about that again later. A major matter to be concerned with: if you are a woman of childbearing age, then the ACE inhibitors are not for you. They can cause major, major problems in pregnancy. Most doctors, cardiologists, they make their decision as to whether you're a good match for that medication. I would even venture to say that a man of child-making age or in his reproductive years should question whether he should take that medication, because it can make fetal toxicity, which means you're putting something in your body right now during your childbearing years that can cause you to have trouble in creating children and cause you to create children that have great, great challenges in their health. And I could say a bunch about that, but that's what I'll say. So pay attention to that also. So as I mentioned, beta blockers are blocking adrenaline. Everyone knows adrenaline is the thing that makes you feel intense or makes you feel energized. So beta blockers are blocking that adrenaline so that you can relax more in the bloodstream. Important to know that, because it can have the effect of it giving you, the medicine can make it so that you don't feel very motivated. It can overdo its job. When you need adrenaline, sometimes you need to feel that energy to get up and, excite and do things. And the medication can decrease your adrenaline, which can make it so that you have trouble stimulating for your life and getting excited and responding the way you would want to in sports and even in intimacy and other things like that. And it does sometimes have an effect on your sexual life. It can make it so that things aren't as, you aren't as easily aroused by things, and you don't respond as quickly and as strong as you want to. So men and women should pay close attention to this. Beta blockers can also decrease your heart rate, and they can increase lipids. Lipids are like fats in the blood, and they can give you other challenges with the way you regulate your digestive system and move your bowels consistently because of the sort of sluggishness that it can create. We need that intensity for different functions of the body, and if we're decreasing the adrenaline in small trace ways, it can affect other functions and features of our lives. That increased lipids could mean increasing cholesterol in the body, by the way. So that's really important to pay attention to, because nobody needs high cholesterol, especially not while trying to address matters of hypertension. So pay close attention to that. Then there's calcium channel blockers. Now, funny thing about calcium channel blockers is that they're actually not proven to increase the longevity of anybody's life thus far. However, they're primarily prescribed to elderly people and African American people, though they are not proven to increase the longevity of life for any person. But I'll repeat again, they are generally prescribed to elderly people and African American people. Blink, blink, blink. So, important to pay attention to the bottom line. You need alternatives. You need food as medicine. You need to pay close attention to these things. And I'm not telling you that you should drop all your medications. What I'm saying is that if you're in an effort to manage your sickness, I'm going to encourage you to consider looking for a method of stabilizing and reversing hypertension, not just managing it. Managing for me means keeping it where it is and not letting it get any worse. And I'm thinking that we all are looking for a way to stop it in its tracks and reverse it. So I'm no cardiologist, but food is medicine and plants heal. Water is life, and this is your life. Take it, grab it, own it. Be responsible for the choices you make with your well-being.